Many people ask me, Doc, my dad or mom has Parkinson's. What else I can do for them? I tell them that this is a time to give back to them. This is Dr. Anna. I'm a neurologist from Parkinson's Clinic in Scarborough, Toronto. So patients in the beginning might need only emotional support, but as the disease progresses, they need physical support as well. So the family members or children of the patients, they can do certain things which can help to improve the quality of life of these patients. In my own observation, those patients who live with their children or they live in close contact or closer to them, they do much better in long term as compared to those who have no contact with their children or the least contact with their children. If your parents are living with you, then it's important that they have a bedroom on the main floor because their mobility decreases. As the disease progresses, their balance is affected. So staying on the main floor helps them to avoid any falls because they don't have to take any stairs. Also, the washroom should be big enough and spacious because these patients make wide turns, and sometimes as the disease progresses, they might have to take their walker with them to the washroom. Their washrooms should have the handlebars, they should have the non-slip bathtubs, and also the mat. Sometime you can ask the occupational therapist to come and have a look and give you the recommendations. You should also try to take some time on daily basis to sit with the patient and talk to them, and not necessarily talking about their disease or medications, but talk to them just about life, about the past events, about the houses they lived or what they did, about their hobbies, because this helps them to socialize with you, and they might be able to vent their emotions which they build up by sitting alone all day when the children are at work. Going to a walk with them is also helpful. Many patients, they enjoy if someone is going with them to a walk on daily basis. Also, it is safe when someone is with them as compared to if they are going alone, because if they slip or if something happens, at least there is someone to take care of them. In addition, you can watch their food, because as the disease progresses, patients experience that their appetite is less, they start eating less, their weight decreases. So in those times, monitoring what they eat, looking at their weight, and adding some high caloric foods is very helpful. As the disease progresses, patients have trouble with memory, and therefore they may have difficulty keeping track of medications. As their caregiver, watching their medications is very important, making sure they don't delay any medication or they don't skip any of the medications. With the progression of Parkinson's, patients might feel depression, anxiety, or other behavioral changes, for example, hallucinations. So keeping a track of their behavior is very important. If you see any of these changes, make a note of these, and when you come with the appointment, you can discuss with the physician and ask them questions. It's always important to accompany patient to the appointment because you can ask questions, you can provide a list of medications, and some of the symptoms which patients may not know whether they are related to the disease or no, you can relate those symptoms to the physician and they can do the proper treatment or take the steps which can help to improve it. Also keeping a correct list of medications is very important for patients with Parkinson's. As Parkinson's advances, patients may develop hallucinations. They might see things which are not there. So in those cases, explaining them gently, not arguing them or neither enforcing them. So just explain them that these hallucinations are not real, and after you explain, patients may be able to understand. And some patients may develop paranoia. They might feel that their family members are poisoning them, they're stealing their stuff, or they are trying to harm them. So in that case, you can gently explain them. With the progression of disease, patients have issues with memory. They may get disoriented. They are not able to follow the track of time. So therefore, orienting them frequently is helpful. Keeping them in a enlightened place when there are people around, and also telling them what date is that, what day is it, or you can write the date or day on a piece of paper and put on a wall in their room, which also helps them to keep track of these things. So those parents who stay with their children or in close contact, in long term, they do much better. And one important thing at the end is watching and taking care that patients don't fall, because falls, they can lead to hospitalization. Patients can have fractures, they can have injuries, and ultimately they can go to hospital, and therefore their disease can get even further and further complicated. Thank you.